Hello students and viewers, welcome back to my session. I'm thrilled to be here with you again today. And if you're tuning in for the first time, let me introduce myself. I'm Veronica Nriame, working as a psychiatric social worker in District Mental Health Program, Naga Hospital, Kohima. I thank the Department of School Education for collaborating with District Mental Health Program, Kohima. Well, today my presentation will be on gaming and gambling disorders and alcohol use disorder. World Health Organization have recently added gaming disorder in International Classification of Diseases ICD-11 because of the spiking prevalence of gaming amongst the youngsters. So this gaming disorder is characterized by a pattern of persistent or recurrent gaming behavior, digital or video gaming, which may be online as well as offline. So these are the criteria of gaming disorder. First is impaired control over the gaming. And second is increased priority is given to gaming. As a student, your priority is to perform well and excel in your studies. But you give priority to gaming instead of your studies. And the third criteria is continuation of gaming behavior despite of the negative consequences which has taken place because of gaming. For example, because of this gaming behavior, your performance is declining academically, your relationship is affected, you have sleep disturbances or moodiness, irritability, or other aspects of your life is affected negatively. In spite of all the negative consequences that has taken place because of your gaming behavior, you are not able to quit gaming. So these are the criteria to be diagnosed as gaming disorder, and these are the features which should be present for a period of 12 months. In some cases, if the person meet the requirements, it can be diagnosed even at the earlier stage if the symptoms are severe. Similar to gaming disorder, there is called gambling disorder. And even this gambling disorder is characterized by a pattern of persistent or recurrent gambling behavior. It can be online as well as offline. Again, the criteria for diagnosis is impaired control over the gaming, increased priority is given to gambling, and continuation of gambling despite the occurrence of consequences. Because of this gambling behavior, there is problem at home, or your family is falling apart, or there is financial crisis at home, or work-related issues are arising because of this gambling behavior. But you are not able to give up and continue the gambling behavior. So these are the salient features which should be evident for a period of 12 months to be diagnosed as gambling disorder. And again, in some cases, if the person meets the requirements and the symptoms are severe, it can be diagnosed as gambling disorder even before 12 months. So these are the gambling and gaming disorders where an individual who is into gaming or gambling can assess themselves and see if they fall under the criteria of disorder or addiction. If you are, it is always necessary to seek for intervention. Now let us discuss about alcohol use disorder. As this is the platform for the adolescent, I'll focus on that. Adolescent is a time of rapid change and maturation. This is also a stage where they are curious, where they give more importance to their peers or to their friend circle. And again, at this stage, they experiment new hairstyles, new clothing, new attitudes, or new behaviors. So if the individual is into unhealthy practices or experimenting harmful substances, it can hamper their studies as well as great consequences in the near future. Now let us discuss about the patterns of alcohol use or any other psychoactive substance use. The first is dependence syndrome. So when we talk about dependence syndrome, it is a cluster of physiological, biological, behavioral, cognitive phenomenon in which the substance use or the substance consumption take much higher priority in that person's or individual's life. And the criteria for dependence syndrome is first is a strong desire or a sense of compulsion to take the alcohol or other substances, difficulties in controlling substance taking behavior, and there is a physiological withdrawal state. If the person stops the usage or consumption of alcohol, there are other physiological withdrawal symptoms and evidence of tolerance, that is another dependence syndrome, where with every intake, the dosage increases. And again, progressive neglect of other alternative interests or other activities in their lives. And again, the last dependence criteria is persisting with substance use or alcohol use despite the negative consequences. Because of this substance or alcohol taking behavior, the family is falling apart, or there is financial crisis at home, or there is constant quarrel at home, and on top of that, there are so many health complications arising because of the alcohol consumption behavior. But in spite of all this, the person is not able to quit or give up alcohol. These are the dependence criteria where the individual can assess themselves and see whether they are falling under the category of dependence or addiction. Another patterns of use is acute intoxication. Acute intoxication is a clinically significant transient condition that develops during or shortly after the consumption of alcohol, and that is characterized by disturbances in consciousness, cognition, perception, affect, and behavior. And another pattern of use is withdrawal state. This is a cluster of symptoms that takes place when the person stops the usage or reduces the amount of consumption of alcohol. So the withdrawal symptoms are mild tremors, nausea, vomiting, weakness, irritability, insomnia, and anxiety. These are the common withdrawal symptoms. And in some severe cases, the withdrawal symptoms can be delirium tremens, alcohol seizures, and alcoholic hallucinosis. These are the withdrawal syndrome. Again, another pattern of use is harmful use. It is a pattern where the person continued the usage of substances in spite of the consequences or the harmful effects, whether it be physical or mental. It not only affects the person's life, but also the other aspects of their family members or the other aspects of his life. So these are the patterns of alcohol use where the person should consider and see whether which category they fall into, and if they are into any of this category or if it is hampering their day-to-day functioning, it is always necessary to seek for treatment. Besides alcohol use, there are also other psychoactive substance use which is commonly used by our Naga people. The first is inhalants. Majority of our adolescents use or they start with correction fluid, whitener, sniffing dendrite. This is the gateway to other drugs where the adolescent begins, might be due to different peer pressure or out of curiosity. So especially these inhalants are the gateway to other hard drugs. And other psychoactive substance use which is commonly used by our Naga people is SP, nitro, marijuana, which is commonly known as ganja, opium, heroin, brown sugar. These are the other psychoactive substances which are commonly or widely used by our people. Now let's briefly discuss about some of the complications of alcohol dependence abuse. First is psychiatric complications. The person can suffer from depression, suicidal ideation, and other complication is increased blood pressure, which can even lead to cardiac issues, peripheral neuropathy, where there is numbness and tingling sensation of the extremities. This is due to alcohol use, where it causes deficiency in vitamin B1. And other complications are liver complications, gastritis, gastric ulcers, absent-mindedness, memory impairment, and for ill effects for the adolescents is drop out from school. So these are the complications, some of the complications which will happen if the person have dependence or abusing drugs or alcohol. So when we talk about addiction, it is a chronic brain disease where often relapse takes place and there is often compulsive drug-seeking behavior in spite of the harmful use. So the person needs treatment and for the person it will be difficult for them to overcome this addiction alone without medical attention. So let's discuss about treatment. The first step to treatment is detoxification. This is where the person, those who are using substance, where the body will be detoxified or the harmful substances will be detoxified. And this detoxification, the aim is to manage the emergent withdrawal symptoms which the person will experience once they cease or stop the usage of alcohol or other drugs. And after detoxification, if the person wish to go to prayer centers or rehab centers in order to stay sober, there are other means where based on your interest, you can pursue or you can go ahead with this attending prayer centers or admitting in rehab centers. These are the ways where the person will get support to remain sober or to recover from the addiction. Besides pharmacological management, there are also other psychosocial management for the patients, for the one who is suffering, as well as for the family members. So these are some of the therapies which are used for the alcohol users as well as other psychoactive substance users. Motivation enhancement therapy, relapse prevention therapy, family therapy, group therapy, psychosocial rehabilitation, and cognitive behavior therapy. This is the whole package for the treatment of addiction, and these are the tools which will help the particular person who is addicted to any substances to remain alcohol-free or drug-free life. So the person needs to take treatment at the earliest so that he or she will be able to fight the addiction. When we talk about addiction, adolescents appear to be more vulnerable to this addiction process. And in order to break or in order to avoid or in order to prevent this addiction process, early identification and treatment is essential. And early identification and treatment is the only means to break the cycle of addiction. So with this note, we have come to the end of my presentation. Thank you very much for tuning in.